Leigh. I'm a rising sophomore attending a Wake County high school. And to answer your question, I actually do know of many classmates and friends that are struggling with mental health issues at this time. A lot of my friends did deal with mental health issues even prior to the COVID-19 situation, but a lot of it has been aggravated since lockdown started because they're really not able to see other people as much as they did before. And not having that in-person contact with others has just really made people more fearful and uncertain of things that are happening in their lives. And even some of my friends who go see counselors, go see therapists, have not been able to do that in person. And therefore, the effectiveness of that has definitely um, gotten lower. And a lot of people have gotten to this level of fear and anxiety because of that. Even within the last couple of weeks, since we've been seeing things on the news with the Black Lives Matter movement, I think a lot of people have become even more scared since the COVID-19 situation, because while COVID-19 was scary, this is again a situation with humanity itself. And therefore there's a lot of uncertainty, lots of fear among mainly people of color with kind of what's going on and, how are we going to move forward from this in a positive way. So yeah.
And hello everyone, my name is Tahjanee Gibbons. I was a senior this past year at a Wake County Public High School, and I agree with what Vaishnavi is saying, and I'm just gonna kind of build off of that. I do know of friends who have been struggling with mental health since schools have been closed. For some of them, being at home has really exacerbated their symptoms due to constant exposure to like their family and living situations. Also, the stress of managing those issues with the ever-changing economic situations at home and health concerns has pushed many students to the brink of what they're able to handle in terms of their mental health alone. I know a lot of students, their parents may have lost their jobs and now they have like a lot of insecurities in terms of food insecurity and just, or they have high-risk family members. So that's really important that we also address that. This is especially true for students of color who are not only experiencing the trauma of a global pandemic, but the trauma of seeing firsthand institutional, cultural, and systematic racism through videos and news stories of Black men and women being murdered. It has reopened many wounds for students of color, particularly Black students, who are faced with these harsh realities. Following another countless tragedy, I know many students are feeling a complex range of feelings, but they lack the opportunity to express them or the resources to alleviate some of their emotions. I have one friend in particular who, before COVID-19, he had mental health struggles and he did struggle with them. However, he built a relationship with our school's intervention coordinator, which did allow him to communicate those struggles and later resulted in him seeking help. But during this pandemic, many of those strong connections have been severed due to the lack of communication and lack of access. And so he's really been struggling a little bit with his home life and his home living situation, which has caused him to slip back again on his progress that he made. And he's been struggling with another crisis after the next, just because of the uncertain time and he's not able to get access to those resources. So as the end of the school year approaches, I think it's a vital and imperative that it's really important that schools maintain that same level of reaching out to students, checking in on students, because just because the school year ends doesn't mean that their students' struggles ends as well.
Thank you both for such thoughtful answers to that first question. The next question I have is, how do you believe that your classmates or friends are dealing with the increased isolation that has come with the onset of the coronavirus pandemic?
So I would say that the isolation really depends on what the student's going through and what the student has access to. If a student has transportation, they're able to go out and they're kind of able to interact with their friends, or they're able to social distance and find ways to get to their friends. Or if they have reliable internet access, they can have these Zoom calls and they can see people face to face or other things like that. But if you don't have reliable internet access at your home, if you have to walk to a hotspot every time you want to communicate with a friend, if you don't have access to a cell phone, then it is really difficult, and the isolation is dramatically different than someone who's able to drive out to see their friends at their house, do drive-bys and see their friends. Especially if you live in a rural area, like you might not be able to go out to see your friends and you're stuck at home, and that being stuck at home in that way is drastically different to people who are able still to go out and interact, or maybe go get ice cream or other things like that. So also, for people who are living with high-risk family members, a lot of people in North Carolina, they have completely forgotten about coronavirus, and they're going out to restaurants. They're not taking the proper precautions. But if you have a family member who could die if you bring it home, then you feel that isolation and you feel that fear, compared to people who don't necessarily have those same limitations. So I would say that my peers, it really depends on the disparities that they are seeing and the inequities that they have at home. So it really just depends on what the student's going through, and what their living situation looks like. But it can vary drastically, I would say.
And Vaishnavi, do you have anything you'd like to add to that question, or you want me to go to the next question?
No, you can go ahead to the next question.
Okay, all right, thank you. What do you think schools could be doing better to help students through these challenges that they're now facing even more?
So I actually believe there's quite a number of things that schools can be doing in order to help and support students at this time. The first being open communication. This is something that I've been seeing has been very lacking, especially in the past couple weeks. And we really haven't been seeing the amount of open communication we received maybe the first couple of weeks. And I think now more than ever, it's really important that we receive that communication and we, hear from our school administration and kind of hear about what they're going through and what their process is like right now, what they feel like at home. Just having an open discussion with students in order to reassure us and make us feel safe again. I've noticed a lot of times in my school, I'm very lucky to be in a school where my school administration is very open with us, and our teachers are very good at communicating with us. And a lot of our teachers have been talking to us about, the Black Lives Matter movement and how supportive they are of people of color and how willing and ready they are to support those who may be feeling uncomfortable during this time. And they also really like to talk about, what they're experiencing at home, how they're dealing with isolation. And so by hearing that, it really humanizes everyone that's around us and makes us feel that, okay, we're not alone in this. And I think open communication, while that may seem very simple, is I think one of the biggest ways that schools can help us through this time. And now the second thing is giving us more resources. And what I mean by this is there's a lot of students at this time, since schools are ending, they really don't know what to do anymore because I, for one, had a very thorough summer plan and everything that I was going to do has been canceled due to COVID-19. And at this time, I'm very uncertain about what I'm going to be doing this summer, which can lead to a lot of students being unproductive and therefore really struggling through the next school year. So by schools providing us with resources on how to stay productive during this time and things we can do to, keep up with everything that's going on, I think it would be really helpful and beneficial to those students. And on the other hand, there's also a lot of students who have had increased responsibility since this lockdown started because of their home situations, their economic situations. And because of that, I think time management resources for them and, giving them help, the mental help that they need at this time would be very beneficial because there really is two different kinds of people at this time. And so making sure that you cater to the needs of both of them is very important. The third thing is more so having to do with the resources that schools provide once schools restart in August. And I know this is still quite uncertain at this time, but I definitely think that having counselors that are not only academically driven, but also more so towards the mental health aspect and talking more about, what students are feeling rather than just their academics would be very important because at this time, it's very hard for students to understand that counselors are not just for your academics, that you can also talk to them. Because in a lot of high schools, we don't see counselors open up to students like that. And I think it's very important to make sure that misunderstandings should be cleared up, and students have the opportunity to be communicating with counselors that are able to help their mental health issues. And lastly, I think having school nurses, an increased amount of school nurses, because, more than half the schools in North Carolina don't receive at least one nurse per school. It's usually a nurse that's rotating around multiple schools. And with COVID-19 still around and many other health issues that are probably going to rise, once we restart school, I think it's very important to have a school nurse or multiple school nurses who will be, making sure these students are safe and they're not dealing with any issues that are going to affect the rest of the student body. And lastly, I think this adds on to the open communication aspect I was talking about earlier, but I think students being a part of the decisions that schools take in some aspects. So students being able to communicate with school administration, talking to them about, what's working during isolation, what's working with online learning, what's not working with online learning. And therefore, by having that open communication, schools are better able to cater to the students' needs, and students feel like their voice is being heard during that time, because a lot of the times it might just feel like, oh, well, students really don't have anything going on other than just school. But there's honestly a lot more things that are going on in their homes, mentally, and so many other things like that. So I think definitely having that well-rounded communication between the student body and schools would be very vital. And that's all. Thank you.
Thank you. And Tahjanee, would you like to add anything?
I believe that she was right on point with everything that she mentioned. Definitely having that open communication and ways for students to really express themselves and give feedback, especially for students of color, since we are being particularly impacted by COVID-19 in terms of complications and things like that, as well as the Black Lives Matter movement. I think that it would be really vital for that there be a space, just an open space for students to really express what's going on. And for, as I mentioned before, for something to go on throughout the summer, because COVID-19 is not going away right now. And just because the school year ends doesn't mean that students are not going to continue experiencing these struggles throughout the summer. And it's going to fall into the fall as well. So students are really coming in with a lot of mental health trauma right now. So I think it's really important, like Vaishnavi mentioned, that we really just keep up all of these options and really have all these alleys for students to communicate with the school.
Yeah, absolutely. Well, Vaishnavi and Tahjanee, thank you all both for sharing your perspectives this morning. I know you have some questions also that you have for the governor's office. And what I would like to do, if it's okay, is hold off on those and allow Geoff Coltrane from the governor's office to do his presentation, as well as Leigh Kokenes. And then we can loop back with those questions and have a little discussion at the end of the presentations, okay?
All right, sounds good.
All right. So now we have Geoff Coltrane with us, and Geoff works is the education policy lead. Excuse me if I'm mispronouncing your title there, Geoff, with the North Carolina Governor's Office. So please tell us a little more about yourself, Geoff, and then we're looking forward to hearing what you got to say.
Absolutely. And hello, everyone. Thank you for having me today, and to Vaishnavi and Tahjanee. Thank you for what you just discussed and shared. I think it's powerful to have student voices be a part of this conversation, and especially hear some of the issues that that you're hearing from your peers, and that to be a part of this. And so, thank you for sharing that today. As Adam said, I'm the Governor Cooper's Senior Education Advisor. Have been with the governor for the last 3 years in that role. I'm a former kindergarten and first grade teacher in Durham. So I have an education background and have been doing education policy work for the last 15 years here in North Carolina. I'm a North Carolina native. I grew up in Randolph County, Trinity area. And so, actually Ashley Perkinson, who's on your panel, is a former high school classmate of mine, so which is great. So anyway, but excited to be here today. I'll share a couple different things with you on sort of the topic here on student mental health, and particularly the pandemic. and then sort of where things are going with the reopening of schools. When the governor closed schools back on March 14th, initially for 2 weeks, and then it was extended into the middle of May, and then for the rest of the school year, his number one concern around that was, how are we going to continue to support our students, both with learning and also with their physical and mental health needs, particularly for our food insecure families. How are we going to make sure they continue to get meals? But then also, how are we going to make sure that we stay connected with them? And so I know that's been a particular challenge for a lot of schools and school districts. And a lot of our teachers out there and our child nutrition workers and administrators have done heroic things to try and keep those connections going. Through this week, I think there's been almost 30 million meals served to students around the state through our child nutrition services. They're averaging about 500,000 meals a day each weekday, which is amazing. We've heard stories of teachers that are regularly calling their students to check in on them. They're hosting Zoom meetings, they're sending letters, postcards, driving by their homes to see how they're doing. And so I think it's really, it's quite amazing what our public schools have done to try and keep students connected. But I think to what Vaishnavi and Tahjanee shared is that, that the sense of isolation is, for a lot of students and their families, has been tough. And I have a 16-year-old daughter and a 12-year-old son, and it's been mine and my wife's big concern is as well. And even though we're all here together, just wanting to make sure that they're still connecting with their friends and they're still getting that social support that they need. And so I know for a lot of our families where that can be an even more difficult challenge, it's been tough. In recognition of that, as part of the governor's budget package that went to the General Assembly at the end of April, and was a request from the State Board of Education, was additional coronavirus relief funds to try and help support student mental health needs when they return in the fall. The General Assembly did provide about $10 million, which was some money, but not enough for districts to be able to purchase contracted services for school nurses, psychologists, counselors, social workers. And the reason why it was contracted is that that money has to be spent by the end of December. So it's hard to hire someone for a 5 or 6 month position. But we are thinking more strategically about how can we try and make those investments for the longer term, because we know, the pandemic's not going away anytime soon. There's a chance that we're going to be still struggling with needing to socially distance, and could be back in a spike in the fall and in the winter. And so how do we continue to mitigate those things? So the state board yesterday approved a budget request to actually allocate $60 million that would hire additional nurses, counselors, social workers, and psychologists. And this has actually been a big focus of the governor for the last 3 years. He's proposed in his budget tens of millions of dollars each year to try and hire more nurses, counselors, social workers, and psychologists. If we as a state were to try and get to the nationally recommended ratios where we have the right number of nurses, psychologists, social workers, and counselors to the appropriate number of students, it would take a nearly $700 million investment from the state, which just shows how far behind we are, I think, Vaishnavi and Tahjanee, to what you shared. And so the Governor's Commission on Access to Sound Basic Education, which has been looking at the state's constitutional requirements to provide a sound basic education for every student. And Leigh Kokenes, who's on this panel with me, was a member of that commission. One of their big recommendations was to push to meet those nationally recommended ratios. And it's going to take us several years, because $700 million is a large amount of money. But the state board has been on board, the governor's been on board, and the governor's commission. So trying to reach that goal is critical to make sure that our students are taken care of. But to try and help address the short-term needs here with this pandemic, we've got to try and do everything we can to get more of those resources into our schools as quickly as possible. And so the governor will continue to be pushing for that. To give you a sense of what the school reopening may look like, the Department of Health and Human Services, the State Board of Education, and the Department of Public Instruction have been collaborating very closely over the last several months on both how to continue to support our teachers and our students in our schools while schools have been closed, but also to help develop guidance on what school reopening will look like in the fall. And I think everybody's in agreement that we need to try and reopen schools. We need to try and get students and teachers back together and learning and supporting each other again. But we need to do it responsibly, and we need to do it in a way that's going to make sure that everybody stays safe and healthy. And so the Department of Health and Human Services guidance, draft guidance, which is being vetted by a number of folks, sort of lays out a range of things around that. The biggest being that districts should be planning for 3 different scenarios over the course of next year. The first scenario would be an operating of schools that looks similar to what we're probably used to. Most or all students are back in the school, but we have a lot of public health requirements like screenings for students coming in. We're trying to be socially distant where feasible, so not allowing for large gatherings of students, maybe no assemblies or big events. Maybe students would be eating lunch in their classroom instead of in the cafeteria, trying to mitigate those types of things. But we're able to have most students back in the building. The second plan, the second scenario would be is if we've got an increase in our rate of infection, or there's some spikes around the state, then we might need to limit the number of students that are in a building, and that would allow schools to appropriately socially distance. So maybe only half of the students would be in school at a given time, and the other half might be at home learning remotely. And so helping districts to think through what those scenarios would look like. And then the third scenario, which actually the General Assembly included a requirement for districts to plan for this in the bills that were passed at the end of April, is if our numbers get particularly bad and we're all required to be at home again. And that would be a plan for every student to be learning remotely like we have been for the last 3 months. And so what's going to happen is next week, the State Board, DPI, and DHHS are going to release guidance that will be both the public health guidance, so what are some of the health requirements, but also what ideas and recommendations can districts work from to be able to put that guidance into operation. So what are some recommendations that they can use to be able to make those things work? And then districts will begin to develop their plans from there on what school will look like in the fall. And then as we get closer to August, there'll be a determination as to where should we be? Should we be in the Plan A scenario where we have most or all students back in the building, a Plan B scenario, or a Plan C scenario? So just be ready for, on the lookout for that as it comes out, and we'll make sure it'll be shared widely, I'm sure. So, but to keep you posted. The guidance from the public health community will also include recommendations on masks, as well as social distancing and how to handle transportation and other types of issues that I know have been top of mind for a lot of folks. So people will be taking this and then working their way through it and beginning to figure out how we'll get students back in school in the fall.
Geoff, thanks so much for sharing that. If you're able to stick around with us for a few minutes,
absolutely.
Yeah, great. And we'll allow Leigh to present, and then I know we've got some questions in the chat box, and we can have a little bit of a discussion. Next, I'd like to introduce Leigh Kokenes. Hopefully I'm pronouncing your last name correctly, Leigh. And for you all who don't know of Leigh and her wonderful work, she is a school psychologist in Wake County. And last year, Leigh was the National School Psychologist of the Year. So right in here in our midst in North Carolina and Wake County, we have Leigh, and she's going to talk to us some more about student mental health.
Thank you. Can everyone hear me?
Yes.
I just wanted to say hello to everyone, and thank you very much for including school psychologists and me in this conversation. I had a few slides that I gave to, okay, there we go. So I'm gonna go through those. Just give me a minute here. If you want to advance to the next slide, where I can just give just a quick snapshot of the different, I mean, I just call these quick facts. These are the quick facts of what our story looks like. The next couple of slides tell the story of what our school psychologists in North Carolina are battling. We have about 772 school psychologists who are employed in North Carolina public schools, and about 743 of us are school-based psychologists for students. And I want to make a distinction between when we see differing numbers for the number of school psychologists that are in North Carolina, about 743 of us we're working directly with students. I report to an elementary or a middle school every day of work. We have several other positions across the state that are lead positions, director positions, central office-based positions, perhaps a position to address multi-tiered systems of support. And then the bulk of the school-based school psychologists are located in Wake County Public Schools and Charlotte-Mecklenburg schools. So think of that in terms of we have a lot in urban school districts. As far as our licensed workforce, we have 1,251 total school psychologists in North Carolina. And that's only about 60%, or that means only about 60% of our employable workforce is in public schools serving our 1.5 million school children. We all serve multiple schools. And I want to repeat that. All of us, with the exception, I think, of Union County, serve multiple schools. I serve 2 schools, but I have colleagues across the state who serve 5 or 6 schools. As of May 2019, there were 80 statewide vacancies. If you'll click to the next slide. So we have 22 North Carolina school districts, all of them rural, that have no or less than one-time full-time employed school psychologist. They have to contract for a school psychologist to come in and provide limited services, and mostly it's evaluation services. And that means limited access for those students in those 22 rural school districts. And again, that's you know, we have 1.5 million school children that have limited access to mental health professionals, with the 772 of us who are providing school-based services. And I just wanted to, I want to note that this reduces access to students with disabilities, to professional educators in school who are extremely and deeply knowledgeable about IDEA and special education policies and procedures for protecting their rights under federal law. African American children, Latinx children, and children living in poverty are disproportionately impacted by this across North Carolina. If you'll click to the next slide. I'm going to just quickly, this is just a quick snapshot just to give you, this connects to the next slide, but just from 2017 to 2019, this was a quick snapshot of DPI data that we have, and that just, we don't have school nurse, I didn't have the school nurse information from that, but other specialized instructional support personnel are were gaining positions as we were losing positions, and we continue to have difficulty recruiting across state lines to fill our vacancies. If you'll click to the next slide, this is very, very recent data showing, this is spring 2020 workforce data. This was a school psychology, school counselor position study that came out of House Bill 75, which I believe is session law. I can't remember the numbers, I'm sorry, but in 2020, with all that's happening in the world and with all the weight that we know, and especially from what our student voices are telling us, that children they're carrying a lot of mental health weight with them to school. This shows what you're seeing is the region names are the DPI regions across our state. This illustrates the limited access and inequitable resource allocations across our state. This disproportionately impacts students with disabilities and students of color in rural communities. And we, let's see. So if you just want to, does anybody have any questions about this? This is just what I pulled off of the position study, and I will tell you that I got access to this on Wednesday, so I've had, just a couple of days to look over it, but I did pull this out, and I included a link in the PowerPoint if anybody would like a copy of that after the meeting.
Yep.
I do, however, however, tell you that there is some of this data is not completely valid, and I don't say that as a criticism. I'm so happy to see that there was a position study, but I can tell you that there's 2 counties in particular that that apparently reported that they had more positions that they did, and I don't think that they meant to do that, but they reported that they had 1 school psychologist for each school in the district, and that skews the data. One district reported that they had 23 school psychologists, but they had 7. And then another district reported that they had 48 school psychologists, but they had 16. It's because they had 48 schools, but in fact they have 1 school psychologist serving about 3 schools in that district. So it looks like they have a lot more positions than they have. So we will be reaching out to hopefully correct that.
Leigh, quick question from the chat box. Does GUI, does that mean guidance counselor?
Yes, I do. But, I will tell you that school counselors do not like to be called guidance counselors. They want to be called school counselors. That's their role. So, but yes, to answer your question, GUI stands for guidance counselor. It's just kind of an old-fashioned title for them.
Thanks.
Okay. Any other questions? I'm trying to keep track of my time here because I know I have limited time.
Well, and we can certainly loop back, now too, if we have this questions from the students, and we can loop back to the chat box. Fawn can ask out any other questions that folks might have as well, Leigh.
Okay. So I'll get through. I'll move to the next slide because the next slide's a very meaty slide, and I wanted to make sure that I was addressing the concerns and the questions because Fawn had asked me specifically about policy solutions on the table. And so what I've done is I've listed out and included a link in here for the 5 different bills that either have passed or that we are keeping an eye on, but we are mentioned in all of these that I have listed on here. The first one is Senate Bill 476, which is school-based mental health, and that has passed and was presented to Governor Cooper on 5/29. And this references the superintendent's working group on student health and well-being. And it is an act to require the State Board of Education to adopt a school-based mental health policy, to require K-12 school units to adopt and implement a school-based mental health plan that includes a mental health training program and a suicide risk protocol. And NCSPA was active in this superintendent's working group. So that's great to see. The next one is the COVID-19 Recovery Act. That was House Bill 1043, Session Law 2024. And that's $10 million to the Department of Public Ed to be allocated in a manner consistent with the formula for instructional support personnel allotment. And these funds can be used for contracted services, which I know will greatly benefit rural communities, which makes me very happy to hear. And that is for school health support and personnel to provide additional physical and mental health support services for students in response to COVID-19, including remote and in-person physical and mental health support services. For purposes of this, the term school health support personnel does refer to all of what we refer to as specialized instructional support personnel, which is school psychologists, school social workers, school counselors, and school nurses, because we are a team within schools. The third one is House Bill 1192. That is the Student Health Collaborative Pilot. And this is funds to establish a student health Collaborative Pilot Program to provide support to students while in public school settings. That's $5 million in non-recurring funds, and that's to establish a one-year student health collaborative pilot program through grants awarded to 5 counties. And we have asked for an amendment to have school psychologists added to this bill. As it was written, clinical psychotherapists and school resource officers were named, but not school psychologists. And so we're in this work, and we're hopeful that there will be further edits to this bill to add our names to that. We also have House Bill 1206, and this is an act to fund additional school mental health support personnel in response to anticipated greater need due to the impacts from coronavirus. And that this is $480 million in recurring funds to increase the instructional support allotment. And then finally, we have Senate Bill 844, which is student mental health well-being. And Senator Chaudhary and Senator Smith are the primary sponsors of that. And that is, I believe that was put through last year as well. That's $480 million in recurring funding. And this, like I said, has been filed at least last year and maybe even the year before that. This is aimed at getting specialized instructional support personnel staffing closer to the recommended national ratio. And NCSBA is currently talking to primary and other sponsors for this bill. Are there any questions around any of those? Before I wanted to talk for just a couple more minutes, I do want to address the student voice.
Yeah, if you could go ahead and just do that, Leigh, and then, you know, as we're running shorter on time, that can lead us into our question and answer period here. Okay,
so I just want to thank the students for their voice. I want to tell them, especially, but everyone, that in every conversation and departmental meeting we have, student mental health and safety needs are prioritized. And the current legislation reflects this decade-long push of North Carolina school psychologists. Specifically to answer some of the students' questions, statewide, many school districts have trained all student support services on evidence-based programs. Examples include, for example, ones that I know of, excuse me, coping cats and zones of regulation for all grades and ages. There's social emotional learning curriculum that's in elementary school classrooms. That's for all students. School psychologists in many districts, as well as other specialized instructional support personnel, are trained on cognitive behavioral therapy. We have had and will continue to have all staff trained at the beginning of the year, recognizing signs of suicidal ideation, recognizing signs of human trafficking, and we are aware that access to community resources is all over the map, and we understand that it's dependent on families' awareness, ability to seek services, transportation, financial means, and other variables. And districts have been manning crisis lines, and families are reaching out to schools and will continue to do that. So I hope that answers or provides, you know, some additional information to the student voice, because I just want to honor that they are in the middle of all this as well and have concerns. Is there anything? I know I'm probably over my time.
Well, no, that's great, Leigh, and we really appreciate the work of NCSPA and your overview on the policies that are, you know, either have been enacted or in process with the legislature. I think there may be an opportunity to answer some questions too, as I know we've gotten some in the chat box as we move forward. I wanted to quickly, if we could, Fawn, pop the slide up with Vaishnavi and Tahjanee's questions and allow them. Would you all like to expand upon these at all? These, we may not get the answers to all of these right now on this call, but I imagine, you know, we can get the answers. But y'all have anything you'd like to add to this list here or explain about it?
Tahjanee, do you want to get started?
Oh, yeah. Well, I don't know. since this, I think the first question pertains more to you, if you want to expand upon that one.
Yeah, okay. So a lot of the standardized testing has, for the most part, been suspended over the lockdown period we've been having. But we feel like, students have really been falling behind since lockdown started because, our academic learning hasn't been as efficient as it is in person. And we just wanted to ask if the standardized testing is going to be suspended next year because, a lot of students are behind and we don't really feel like it would be fair for students to be graded on things that they don't really have a strong background on, because a lot of next year is going to be a continuation of, what we learned this year, and not having a strong background knowledge on the stuff we learned this year is just really going to impact, our level of success next year. And we just really wanted to know if we were going to be graded on standardized tests, and if that was something that was going to be pursued next year.
I'm happy to take that, Adam, if you can.
Yeah.
I think that's a great question. And I think you really hit the issue head on there with sort of students not all students getting sort of a full instruction during the remote learning time, which was the big reason why the standardized tests this year were canceled or were eliminated. I think in terms of next year, I would think it's probably something that we'll be keeping a close eye on in terms of how the school year goes next year. I think at this point, it's probably too early to say what direction we'll be going. But the hope is that students will both be back in school and that the remote learning experience, if it's needed, will be more equitable, that more students will have access to what they need, so that we can make sure that everybody's staying on pace and not falling behind. But I think it's a great question, and one that we'll definitely be keeping an eye on. That requirement to suspend standardized testing actually started with the federal government. So our current standardized test, there's a requirement by the federal government to administer standardized tests, and they waived that requirement, which then allowed the state board and then the General Assembly to waive those requirements as well. So, but it's definitely something we'll be keeping an eye on. The other side of that, I think, to your point about students being behind this year, the General Assembly did appropriate $70 million to help mostly elementary school students, so rising first through fifth graders, to bring them back into school a couple of weeks early, to give them a jump start, to let them get started early, particularly if they were behind in reading and math when schools closed in March. So there are a lot of districts that are developing plans around how to get students more quickly up to speed so that they'll be ready for the next school year. And that's also something the governor's been thinking about as well, is how can we continue to support those efforts in districts.
Thank you, Geoff. I appreciate that. And, I apologize that I do think we're going to need to move on here just for the last segment, the legislative update segment of our call. But what I'm hoping is, can we have a commitment perhaps, Geoff, to stay connected with Vaishnavi and Tahjanee to maybe, respond to these other questions here. I know you mentioned some of these answers are going to come out with the instructions that are coming out in the coming weeks. But if we could just, agree to continue that, that would be wonderful.
Absolutely. And I'll put my email in the chat, but Vaishnavi and Tahjanee specifically, please email me with other questions, or if you'd like to set up a time to talk by phone, I'm happy to talk further with you. So.
Thanks so much. And Fawn, do we have any other questions in the chat that we could get to quickly before we get to our legislative update?
We had a quick clarification just about the last two bills Leigh was talking about. The question is from C. Morris. Are both of those last bills for $480 million?
Yes, I think they are.
Okay,
that's
great.
That's what I have written down, and I might be wrong about it, but I looked at both of them last night, so that's correct as far as I know.
Great, thanks. I think that's all we can get to right now, Adam.
Okay, wonderful. Thank you. So I would like to now, with our remaining time, kick it over here to Ashley Perkinson, who is going to speak first and talk some, I think, specifically about the suicide prevention bill that we're calling it that has recently passed through the legislature. Ashley.
Yes, thank you so much, Adam, and thank you to our panelists, and special thanks to Geoff for the Randolph County shout out. Geoff was valedictorian in our senior graduation class, and you will not find a nicer or smarter person. So thank you, Geoff, and thank you for all that you and the governor are doing to support student mental health in North Carolina. So yeah, so Senate Bill 476, suicide prevention has been a priority for NC Child over the last really 2 bienniums. And we have seen a suicide prevention bill pass the House a couple of times. We even had the language, it was included in the budget bill one year. And Representative Horn on the House side was very much a proponent to include suicide prevention training. And thankfully we saw Senate Bill 476 pass this just in the last couple of weeks. And I do want to mention, this was a very strong stakeholder initiative. So thank you to the stakeholders who worked on this bill. Wanted to mention specifically, of course, the school psychologists. So thank you for being on the call today and for your work on this bill. Also, the American Foundation for Suicide Prevention was very supportive and helpful in moving that bill forward, and also the School Boards Association. So thank you. It was very much a joint effort. And this bill, again, was suicide prevention. So in North Carolina, again, this issue rose really to the forefront of NC Child's priorities over the last few years, in part because we've seen the number of youth suicides in North Carolina increase to over around 50 a year. So when you think about that, that's 1 suicide a week in North Carolina for our youth, and these are preventable tragedies. And so this has been a focus area for NC Child. As was mentioned earlier, so this bill does require the State Board of Education to develop a mental health policy. And in conjunction with that policy, mental health training will be required in our schools, and a suicide risk referral protocol will be developed. There are other categories of mental health training that will also be included, and that includes youth mental health, suicide prevention, substance abuse, sex abuse prevention, sex trafficking prevention, and teenage dating violence prevention. So a number of issues that are included in the categories that the school personnel will be trained on. And also just from the amount of time that will be dedicated to this training for employees for the first year of training, it's an initial 6 hours, and then subsequent years there will be 2 hours of training for the following years. So we're really excited that this bill passed. Again, it was the language that a lot of the stakeholder groups really were supportive of, and also wanted to mention Senator Ballard on the Senate side led the discussion for Senate Bill 476. It came out of the conference committee. Everybody was pretty supportive of the language, and great to see that bill pass the legislature, and now it's on to the governor for his consideration. So thank you for everyone who worked on the bill, and thank you to all of our panelists for such a great discussion on mental health today.
Yeah, thanks so much for that update, Ashley. Maybe if we weren't in the time of social distancing, we could all go for a bill signing or something together. But it's great to see that it's happened, and it should help with the situation. So next, and last but not least, certainly, we want to pass it along to Whitney Tucker, who is the policy director at NC Child. Whitney.
Thank you so much, Adam. So per usual, everybody, I'm trying to fit in a lot at a little bit of time at the end of our call. So if you have questions, just drop them in the chat box, and I'm going to go through this as quickly as I can. So regarding some bills to watch, I'll say that the first series of 2020 mini budget bills is heading to the governor's desk today after some unanimous Senate votes yesterday. One of the bills is HB 1187, which would allocate $10.4 million for construction of 3 different juvenile detention facilities, which is actually the next phase of the raise the age process for moving 16 and 17-year-olds out of the adult prison system. Those facilities are in Rockingham, Granville, and Perquimans counties. Another bill that's moving right now is HB 1050, which passed the House and is now sitting in Senate Rules Committee. That bill would require consideration of early childhood learning and improvement plans for low-performing local school administrative units, or LSAUs. And it would also require comprehensive needs assessments for those LSAUs to include analysis of early childhood learning. HB 1048 is also worth taking a look at. This bill, which is titled CPS Intake Screening and PED Recommendations, has a Senate companion bill that's S708. The bill would prevent county DSS offices from creating their own Child Protective Services intake screening criteria that differs from the state screening criteria. And it would also create 2 new positions at the state's DSS office to serve as consultants for social services workers who might need clarification about whether to do a screening. HB 1048 passed favorably out of the House Judiciary Committee, but some representatives did express concerns about expected budget restrictions in the state impacting the ability to hire the consultants, and also a potential backlog in court if lawyers subpoena DSS workers regarding what advice they gave or received. The bill was sent yesterday to the House Rules Committee. And the last bill that I want to bring your attention to is HB 1229, which passed unanimously in the House yesterday. The bill directs $2 million to fight unemployment insurance fraud, and it importantly authorizes the state to apply for a federal waiver allowing able-bodied adults without dependents, some of you might be familiar with the term ABODs, to continue to participate in the SNAP food assistance program. This authorization will be a really big deal as the state moves from coronavirus emergency phase into recovery, and a lot of residents continue to struggle to get back to work. Some of you might remember this from NC Child's legislative ask letter at the beginning of the session, but we think that this will make a really big difference in fending off adverse community circumstances, particularly in the most economically depressed areas of the state. Now for a quick budget update. This one is pretty short because there really isn't much new to say here. The GA is expected to continue passing mini budgets rather than a comprehensive state budget. They are still waiting to see what, if any, additional guidance the state might receive from the federal government about the potential to fill in the state budget deficit with about $2 billion that we have remaining in coronavirus relief funds from the CARES Act, which, to be clear, were designated by Congress to be used by December 30th of this year for coronavirus relief. As far as a timeline, some members have noted that they may do a revised state budget after July 15th. And finally, I want to clarify that the state needs our coronavirus relief funds right now. Lots of things like the immense need of the childcare sector were left largely unaddressed in our state level relief effort. So at the federal level, the House passed the HEROES Act, which is not going to pass in the Senate, but it does give a good framework for our advocacy with the Senate delegation. NC Child is reaching out to Senators Burr and Tillis, and you should really be doing the same, to ask them to include state budget relief funding in the next coronavirus relief bill at the federal level, among other needs in the state. There will be no need for us to use our designated coronavirus relief funds in North Carolina to prevent budget cuts if we are just receiving additional funds from Congress. And in the meantime, we need to keep requesting that our state legislators release the billions of dollars in funding that North Carolina has today to meet our state's urgent coronavirus relief needs that we have today. So that's it for me.
Wonderful. Thanks, Whitney. As always, we appreciate you staying on top of a million details. And just to reiterate what Whitney was just saying, you know, again, a couple major priorities, I think, for NC Child and the bigger picture over the next month or two is, one, advocating for the release of those COVID-19 relief funds here in North Carolina, where we still have about $2 billion that haven't been released. And two is doing whatever kind of federal advocacy we can, particularly with Senators Burr and Tillis, to talk to them about the importance of state relief. Another big issue that we're pushing at the federal level is increasing the amount of Medicaid dollars that can come into North Carolina. And I won't get into the dirty details of that right now, but we'll be providing more information about that in the days ahead as well. Fawn, do we have any last questions in the chat?
I see one last question from Dr. Clark Pearson about clarifying the message we need to get out to our U.S. senators about, getting more funding for COVID. And I think that's, we were talking about both federal and state. And so I think that's something we can clarify. NC Child put out an action alert yesterday asking state legislators, please release our existing COVID-19 relief funds. That'll be in the follow-up email we send to you today so that you can contact your state legislators. And we'll be putting out new language about reaching out to Senators Burr and Tillis about what we want to see in a federal relief package soon. So you'll see that coming out from us soon too.
Absolutely. And as I mentioned also at the beginning of the call, you can listen to these and share these recorded weekly update meetings with others. They'll be recorded both in English and Spanish. You can always go to our website and get more information. Fawn and others do a real good job of keeping our COVID-19 page updated with resources. And feel free to reach out to us at any time with any questions, issues, concerns that you may have. Some of those questions that were in the chat box and that conversation that was directed towards Geoff and Leigh and others, we will make sure and help facilitate that conversation as well after this call. Thank you everyone for joining us this week. Have a wonderful weekend and we'll talk soon.
Thank you very much.
Yeah, thank you. This was great.